Good afternoon, ladies and gentlemen. Thank you for the opportunity to present our study. I have nothing to disclose. The use of robotics in bariatric surgery has been evolving since Kadir et al. Reported the first adjustable gastric banding in 1999. Subsequently, in 2000, the first robotic gastric bypass and the first robotic sleeve gastrectomy was performed. However, in this minimally invasive era, only a few retrospective comparative studies have demonstrated clearly that the advantage of the robotic gastric bypass. In this meta-analysis in 2016 has shown similar outcomes comparing robotic versus laparoscopic bariatric surgery. But robotic bariatric surgery had significantly longer operative times and higher hospital costs when compared with laparoscopic approach. However, the incidence of anastomosis leak was lower in the robotic bariatric surgery of about 1% compared to 1.3% with the laparoscopic approach without any significant difference. One important point is that even in this meta-analysis, the total number of patients were low. And also in the bariatric surgery, when you have a lower complication rate, so it's important or it's necessary to have a significant number of patients in order to have a meaningful statistical analysis and conclusion. Another important factor is the operative time. Previous studies have demonstrated that longer operative times is an independent risk factor for more post-operative complications, either in the general surgery field or in the bariatric field, especially complications like venous thromboembolism. So we raised the question that longer operating time maybe with the robotic approach is an independent risk factor for adverse outcomes. With that in mind, Cilio et al. Performed a propensity score matching analysis, including operative time and preoperative characteristics to compare outcomes between laparoscopic versus robotic gastric bypass, reporting higher complications in the robotic approach. However, the surgeries were from 2007 to 2012, which clearly represent an early initial experience in the robotic bariatric field. The goal of our study was to investigate 30-day outcomes of robotic assisted versus laparoscopic raw and wide gastric bypass and sleeve gastrectomy using the MB-SACA database from 2015 to 2016. We included patients between 18 to 65 years old who underwent sleeve gastrectomy or raw and wide gastric bypass with conventional laparoscopic or robotic assisted approach. In order to eliminate any selection bias of co-founder, we performed 2 consecutive propensity score matching analyses. The first analysis, we include only preoperative characteristics, and in the second analysis, we include, in addition to the preoperative characteristics, we adjust for operative times and conversion rates. We identified more than 269,000 patients in undergoing sleeve gastrectomy and raw and wide gastric bypass. In both groups, about 6 to 7% of the surgeries were performed using the robotic assisted approach. For the sleeve gastrectomy, in the first analysis, we matched almost 30,000 patients in each group, resulting in operating times of 73 minutes for the laparoscopic approach and 102 minutes for the robotic assisted approach. And after matching in the second analysis, including operative times and conversion rate, the operative times were almost similar of about 100 minutes. For the gastric bypass patient, we matched about 6,000 patients in each group. The operating time was 120 minutes for the laparoscopic approach and 158 minutes for the robotic assisted approach. In the second analysis, after matching for operative times, the operative time were similar of about 155 minutes in both groups. The results. In terms of 30-day outcomes in the leaf gastrectomy in the first analysis, there was a significant reduction of postoperative bleeding and stricture formation with a robotic assisted approach compared to laparoscopic approach. And there was no significant difference in the other 30-day outcomes. In the second analysis, after adjusting for operative time and conversion rate, there was no significant difference in the rest of the outcomes. So in this slide, we compare both analyses for the leaf gastrectomy, and we see that there is a significant difference in restrictions, in stricture formation and bleeding, but no significant difference in the rest of the outcomes, even though after adjusting for operative time. For the Rowan-Wyatt gastric bypass, in the first analysis, there was a significant reduction of blood transfusions without any significant difference in the rest of the outcomes. But in contrast, after adjusting for operative time and conversion rate in the second analysis, there was a significant reduction of anastomosis leak, venous thromboembolism, renal complications, in addition with the blood transfusions. In this slide, we compare both analyses, and after adjusting for operative times and conversion rate in the Rowan-Wyatt gastric bypass patients, there is a better outcomes in terms of 30-day complications using the robotic approach compared to laparoscopic approach. In conclusion, our study shows that bleeding and blood transfusions are significantly reduced with the robotic approach after adjusting for patient characteristics. And also, after correcting for all factors, including operative times, the robotic assisted approach shows significantly better post-operative outcomes, specifically in Rowan-Wyatt gastric bypass patients. Definitely, there is a need for a well-established randomized controlled trial in the robotic bariatric field. Thank you.